Thank you very much, and thanks for inviting me to speak today. So I'm going to talk about surgical menopause in high-risk women and explain what that is and what the implications of that might be for health. So I'd like to start by talking about what menopause is. Menopause is the permanent cessation or stopping of menstrual periods. And it happens to all women who survive until the age of 50 or thereabouts. And it's thought to happen spontaneously because the ovaries run out of eggs. Now, surgical menopause, which is maybe more relevant for this audience, is the removal of both ovaries before natural menopause. And I'm going to talk now about the connection between ovarian cancer and surgical menopause. So one connection may be through genetic or inherited factors, because some women are at increased or high risk of ovarian cancer because they have a gene mutation, such as the BRCA1 or the BRCA2 gene mutation, which increase their personal risk of ovarian cancer. And we know from extensive data that removing the fallopian tubes and the ovaries for high-risk women substantially reduces their personal risk of ovarian cancer. It doesn't completely remove the risk, but it does reduce it very substantially. And at the moment, the guidance for women who know that they're at high risk because of a gene mutation is that they undergo risk-reducing salpingo-ovarectomy before the age of 50, which is around the age of natural menopause. So for most women who are undergoing surgery to reduce their personal risk of ovarian cancer, they will have their ovaries removed before natural menopause, and so they will experience surgical menopause. In terms of a personal history of ovarian cancer and menopause, the treatment for ovarian cancer is often surgical, and it will include removal of both ovaries, even if only one ovary has been affected by the cancer. And for women who experience ovarian cancer before natural menopause, then this surgery will bring about surgical menopause. And in terms of classification of menopause before the natural time, we refer to it as premature if menopause occurs before the age of 40, or early if it occurs before the age of 45. From age 45 onwards, the timing of menopause wouldn't be considered early or premature, even if it's happened prior to natural menopause. So the symptoms of menopause will differ substantially from one woman to another. Some women may have very minimal symptoms, and some women may have problematic and troublesome symptoms for which they want to seek treatment. Some of the most common symptoms include hot flushes and night sweats, vaginal dryness, sleep disturbance, which may be due to hot flushes during the night, also called night sweats, and mood disturbance, which may include an increase in symptoms of depression and sometimes anxiety. And those symptoms are generally temporary, but temporary may involve continuing symptoms for several years. We don't actually know how long symptoms continue after surgical menopause. For those women who feel that they want treatment for their symptoms, there are a few options to consider. Changes in lifestyle might be helpful for some women, for example, dressing in layers, so it's easy to remove some clothing to cool down, and various devices for cooling, perhaps even cold water or other such fans. There's an increasing body of evidence around non-drug treatments. For example, cognitive behavior therapy can improve the experience of hot flushes and night sweats. The most effective treatment is HRT, or hormone therapy, which includes estrogen for the treatment of symptoms and for those women who still have a uterus should include a progestin. But women with a personal history of breast cancer should avoid taking HRT. We don't have very much evidence about the use of HRT after a personal experience of ovarian cancer, but the evidence that we have suggests that it's safe. There are also non-hormonal treatments, some antidepressants and a medication called gabapentin that can reduce hot flushes. And at the Royal Women's Hospital, we run a dedicated service called MSAC, or the Menopausal Symptoms After Cancer Service, which is available for women in Victoria either at high risk of ovarian cancer who are considering risk-reducing surgery, or those with a personal history of ovarian or breast cancer. Thank you.
Thank you so much, Professor Hickey, for providing us with that valuable information. We really appreciate it. There's just one question that has come through, and for everyone who is on the line, if you have any questions, please type them in the chat box in the bottom left-hand corner of your screen. But one of the questions is, who should I talk to if my doctor has recommended surgery as the most appropriate form of treatment, and I don't agree with that, if I want to know what other options there are?
So the people who have the most comprehensive information about risk-reducing surgery are the family cancer clinics. So depending on who you mean by the doctor has recommended, family cancer clinics have the most information, and that includes doctors and also, genetic counsellors. You can also talk to your GP, and the person, the gynaecologist who might be performing the risk-reducing surgery can also provide information. The other information that's available is on the Australasian Menopause Society website about surgical menopause.
Fantastic. Thank you very much, Professor Hickey.